I wrote this, I had a practice afterwards, and it actually lasted an hour and 15 minutes, so I do apologise, so I'm going to kind of concertina it a bit and rush through things which, you know, are really not as relevant. My name is Greg Wimborne. I run a clinic called the Kaizen Clinic, and we specialise in treating people with chronic, long-term conditions that mainstream have not been able to resolve. And those fall into four categories, which I'll go on to in a moment. I have had a very checkered career, as probably most people who get into a therapy have. I used to sell advertising for a medical magazine. I got into a medical advertising agency. I then moved into maximising profit consultancy. I then went into exhibitions, but strangely enough, it always seemed to be in the medical world. And then finally, I got into being a clinical homeopath. In 1987, I was suffering from what my doctors told me was asthma. I had constant runny nose, both forwards and backwards. I was always phlegmy, and I sneezed. I would sneeze maybe 15 times in a row. It would put my muscles out. I'd go into spasm, and they said, it's asthma. So they gave me all these puffers and blowers and all the other kind of stuff. And it managed it a bit, but it really didn't do anything. And I saw an advert in our local paper for a clinical homeopath. Then I didn't even know what a homeopath was. I went to see her, and within 6 weeks she sorted me out, and since 1987 I have never had a recurrence of the condition. As an aside, before 1987 I'd never had asthma or any symptom, and as I understand it, asthma is something that is from childhood. Late onset asthma is a thing that people talk about, but again, from what I've learned, I believe it's something that will have come from way, way back in the past. In 2006, the company that I worked for in exhibitions went bust, and I thought, if I don't do it now, I will never do it. So I trained to become a clinical homeopath, and that is what I now do. It's interesting. Okay, I talked about the four main areas that we treat. In the 6.5 years that I've now been doing it, we find that people fall into four categories. There's IBS, eczema, migraines and cluster headaches, and ME and chronic fatigue. And those four headings pretty much cover all chronic long-term conditions, and we specialise in treating all four of those. In terms of what causes these, and this is where the contentious bit is, because most people talk about IBS and any of these saying there is no cure. We don't know what causes it. All we can do is manage it. And I'm here today, the phrase I wrote down was to expel the myths. I like to be a little bit confrontational, but essentially I'm here today to explain to you what actually causes IBS, what you can do to eliminate the cause of IBS. So what I'm actually saying is IBS can be treated and completely cured. This is based on the principles of clinical homeopathy and the 6.5 years of practice, and now I think I'm just reaching my 497th patient, so I'm getting up to the 500 mark. Not just on IBS, I should say, but treating people who have these long-term conditions. Now, one thing I'd like to explain about why I'm so confident in what I'm saying is because I actually give a guarantee. Our clinic guarantees that we will cure these people. And our guarantee states that if after 2 months of treatment you do not see any or enough improvement, we will refund you your money. Now, I would argue that to make that statement, you've got to be pretty sure